Dave, the voters of Missouri, over the objections of the Republican legislature, have approved the expansion of Medicaid. And beginning next year or so, about 200,000 people, by some estimates, will be added to the government health insurance rolls. Now, the legislature and certainly the Republicans in the legislature are saying, we can't afford this. You know, 10% of the cost will fall on the state. And meanwhile, you have Washington University and other people who advocate for it saying, it's going to be free. You know, you won't have to pay a dime for it. In fact, the state may actually make some extra money. What do you think?
Well, I think this will be good for the state's economy as well. I mean, it's always good to have have people be healthy and have access to care when they need it. But yeah, I mean, one study estimates that this could boost the state's GDP by about $1.5 billion and create as many as 16,000 jobs.
Yep.
Just it's a combination of the kind of the federal money that will be spent here that was not flowing to Missouri, and just generally a healthier population.
That's certainly true. If you spend a couple of $1 billion extra in the state, which is what would happen, you're going to create some jobs. There are going to be more nurses hired. There are going to be more physicians put to work. There are going to be more clerks for billing and all that stuff. It'll echo through, and the state should collect some tax dollars on those extra salaries and that extra spending. But still, the wide gap between the estimates of the cost of this to the state is rather surprising. WashU study, we'll get into that. The under current, everybody who's now on Medicaid, the state pays 35%, the federal government pays 65%.
Right.
When you expand it, people brought in under the expansion, the state will pay 90% from those. And the argument for the people who say this is cost-free is that a lot of people, not all of the people, but a chunk of the people that you're now getting 65% for would move over into the 90% category. Right. That extra money would be more than enough to pay the state's share of the new people who would join. You think that's true? I don't know.
I don't know. I think both sides are having to make some assumptions that it's really hard to test until we get experience. But if it does cost the state a little bit more money, I think it's money well spent. I mean, just saving rural hospitals alone is probably worth the money. Missouri's lost half a dozen small town hospitals in the last 5 or 6 years, and there are some others that are probably on the verge, on the edge. This should greatly improve the finances of hospitals in some of these impoverished rural areas, and even the urban hospitals should benefit.
Yeah, right now they provide care for free when you can't pay. Yeah. And they try to shift those costs along to people with insurance, like you and me.
Right.
Should take a little bit of pressure off that, which is raising our insurance rates every year. But still,
well, and it was telling to me that the business lobby, groups like the St. Louis Regional Chamber, largely got behind Medicaid expansion. I mean, this is just a good investment in the health and productivity of the state's citizens.
But then if you talk to the governor or Republicans in the legislature, what they're saying is state revenues are down because of COVID. Well, not only that, but the insured population is down because of COVID, which means even more may qualify for Medicaid under the expansion. And we just don't have the money to come up with this 10%. We'll have to take it from the schools. Your children will get worse education. We'll bounce over more potholes if we have to pay for this. On the other side, you have studies from WashU saying it's free. So I don't know.
Well, I don't know if it's free, but it's definitely, it's definitely a sound investment. We've got to, the 37 other states that expanded Medicaid before Missouri did. Certainly haven't seen any ill effects. I haven't heard any state wanting to go back on that decision.
Well, that's the best argument for it. It has happened in other states, and it's happened in other states in recent years, and their spending has not gone up. The amount they're paying for it has not gone up. So maybe Washi was right, and our governor was wrong.
So there was a garbage truck outside. I have the window open. Was it loud?
I didn't hear it at all.
You didn't hear it? Okay.
No, I didn't hear it at all. So that's pretty good.
So okay, it's probably okay then.